West Virginia's 3rd District Congressman Evan Jenkins has long been dedicated to helping infants exposed to drugs during pregnancy. I sat down with him earlier to talk about his journey. Here's a look at our conversation. Thank you, Congressman Jenkins. Really appreciate you being here on my show today.
It's great to be with you. Thank you for the invitation.
I know it's been a very important topic for you, and so that's one reason I'm very happy you can be here, and that's newborns exposed to drugs. I mean, we know that Lily's Place was a labor of love for you, and could you tell our viewers a little bit about the Lily's Place concept and how you were able to advocate and how we were able to work together to get that place up and running, and not only what we've done on a state level, but what you've done on a national level?
Well, I appreciate it very much, and thank you for the invitation. You know, we have all been struggling with this drug crisis, the misuse, the illegal use, whatever capacity of the drugs. There are so many victims, but the most victimized of all the victims, in my opinion, are newborn infants that were drug exposed during pregnancy. We all know what a horrific experience for an adult to go through withdrawal. Just imagine starting those first days and weeks of life having to go through withdrawal. I got a call really about 5-6 years ago from 2 NICU nurses. You're a nurse, you know what a passion it is for caring for people. So these NICU nurses were seeing this incredible increase in the incidence of babies that were going through withdrawal. And 5 to 6 years ago, they were really struggling with what are the best models of care, what are the best protocols in dealing with these newborn infants. These infants are highly sensitized to stimulus, bright lights, sound, even to touch. So how best to medically manage them through the weaning process, how best to therapeutically handle. And you know, the healthcare environment is generally pretty highly regulated.
Yes, it is.
we know different models of care for different disease states. The challenge is we all were caught at a period where we were looking to develop the new models. Your office was extremely helpful, and I really appreciate the all-in approach that you, Secretary Bowling, Governor Tomlin, others said, you know, we got to make this system work. So over the last several years, we helped start Lily's Place in Huntington. It has now become a model that the DHHR and you, Secretary Bowling, have said, you know, let's support trying to experiment, so to speak, with this model. If it works, we can look at replicating it so other babies around the state can receive that same kind of compassionate care. So there's multiple ways to care for these babies. There's not one that's just better over all the others. Our hospitals are doing wonderful work in the NICUs. And for example, at Cabell Huntington Hospital even has an NTU, a neonatal therapy unit. So bottom line, these are the most victimized of all the victims of the drug crisis. Government at all levels and passionate healthcare providers have been working to develop models to make sure that these babies, to the greatest extent possible, get a healthy start in life.
Well, you know, this past year, we, you know, at your urging, we created licensing regulations, and we believe Lily's Place will be the first licensed provider of care for infants that have been drug exposed. So it's really sort of an exciting time because West Virginia is now the model.
Well, you can.
I think that's important.
Well, the fact that you can take a really heartbreaking situation, we wish it never occurred in the first place, but the fact that we have at every level stepped up to the plate, identified a need, and worked on a solution, and now that solution is serving as a model, not just for the community that I'm from in Huntington, but also statewide, and also with legislation that is now actually been signed into law by the President. It will be a model that can be replicated in other parts of the country. So again, out of a tragic situation, local leadership, passionate people, people willing and committed to doing the right thing for newborn infants, we can feel, you know, proud of the fact that we are making progress. West Virginia is a leader, and we are a leader because we care so much.
I agree with that. I mean, I do think, if you just look at the excitement around what we're able to do to help these babies and work with their families.
Yes.
I mean, the reality is they will have to go home or to a family member or to foster care, and we have to make sure the environment is right. And how better to do that than ensure the babies are receiving the right care and that there are trained people that can educate those family members or those foster parents or reunify those babies with their parents because the parents are getting help. That's all part of the process, isn't it, Congressman?
How many times have we collectively sat around the table just feet from where we're sitting, and you talked about the wraparound services that a facility like Lily's Place. Let me take a step back. What is a Lily's Place? A Lily's Place is a standalone facility that has top quality care management, has physician-led, nurses, passionate. It is a healthcare delivery system and structure designed for the baby's needs, but also the wraparound services that your office identified very early on. Again, great care in a hospital, but sometimes there are some limitations in these wraparound services, the counseling for the mothers, the family, the care treatment model moving forward, trying to make sure that these things don't happen again. But that's what this is all about, is not only taking care of the baby in the most appropriate, clinically managed environment, but also making sure that the services, sometimes behavioral health, social services, so that kind of that family structure, and candidly we know that's can be a tough family environment, is the best possible, so when that baby does go home, that baby has the best chance for a healthy start in life.
Oh, and that's key. I mean, I know that we've done a lot of work on the challenges that we face in West Virginia with the drug epidemic, and I know that you have also helped battle that on the national level. What more can we do? Lily's Place is very important because we're working toward ensuring that the babies get the right start in life. We also need to recognize that West Virginia still, there's a lot of tragedy here with the substance abuse problem.
There really is, and we just passed in Congress, it's called the CARA Act. It was a bill out of the Senate. We rolled in 18 separate pieces of legislation on the House side, one of which was my legislation relating to the newborn infants that were drug exposed. That full, complete package then went to conference. The House and Senate worked out what minor differences, and it went to the President, and literally just within the last week, the President has now signed it into law. What this is, the first truly national comprehensive package to address just about every facet of the drug crisis, whether it be the law enforcement component, whether it be the incarceration, the treatment, the recovery, all aspects, charging every federal agency that has any involvement with it with being all hands on deck. And we also financially supporting. A lot of criticism has been about whether or not the federal government has shortchanged the real issue of supporting recovery, treatment, whether it be women's, whether it be our veterans, whether it be the newborn infants. We are making a significant investment. In fact, it's billions of dollars, but we also are breaking down some of the regulatory licensing barriers that exist. So when some people say Washington can't get anything done, we actually have passed something in a bipartisan way, House, Senate, signature by the President, to tackle this most challenging issue.
And that's what we need to do, Congressman, and your leadership has been so critical of that. I mean, it's been so great to see you front and center on this.
Yeah.
Know you personally, know what you've done for West Virginia, and now helping us on a national level. The governor's been committed to this. You've been committed to this. We believe that we have to come up with a solution because we have to do right by the people in the state of West Virginia.
Yeah, absolutely. We are all in because this is such a challenging issue. Everybody is impacted by it. It just breaks your heart, whether it be that newborn infant or a veteran or just, we all have family members. Tragically, my wife had a nephew, 28 years old, died of a heroin overdose. We're all impacted, but thank you for all you do.
Well, thank you, and I appreciate you being on the show and getting the message out. And thanks to all of our guests for taking the time to speak with us about this very important issue. That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling. Thank you for watching The State of Health. Important issue. That's all the time we have for today's show. Remember, you can always follow us on Facebook, Twitter, and our website. I'm Karen Bowling. Thank you for watching The State of Health.